Premier Ford warned the modeling projections are stark, and he let us see them today. And they came with a warning. We could save thousands of lives if people stay home.
You can see from this curve, we are following a trajectory somewhat similar to that in the United States.
But we don't have to stay on that trajectory. Here are the projections. If the province had not put any restrictions in place, modeling concludes Ontario would have had 6,000 deaths by April 30th. If the current scenario that we're doing continues, we would see 1,600 deaths. And if further intervention is taken, deaths would drop significantly to 200. The modeling also shows over the course of the pandemic, which could last as long as 2 years if there's a second or third wave, the death toll could have hit 100,000 if no restrictions were put in place. But the modeling shows the deaths can be reduced to between 3,000 and 15,000 if stronger action is taken.
Early chapters of our story have already been written. And there's some things that are out of anyone's hands. But what matters is that the ending of our story is still up to us. And if we work together, we can write the last chapter of our story.
So today, the Premier said he is limiting the essential services list. It's now down to 44 from 74. Commercial and industrial construction will stop, except for hospital, transit, and residential that already has permits. And cannabis stores will also close, although online sales will continue. Now, I have to caution, these numbers are projections, which can vary widely depending on inconsistent gathering and backlogs in reporting and the number of testing done. Ontario, for example, has done half of the testing per population that Quebec has. But the key point that was repeated over and over, people have to stay home and there will be fewer deaths and the economy could get back on track sooner.
We all want to try to avoid that. That's real extreme, and I think people are smart enough. And vast majority of the people are, like the vast majority, Cynthia, are listening. You get the odd group, and hopefully we aren't going to see this weekend what we saw last weekend. And last weekend was just unacceptable.
The modeling also shows ICU beds are in danger of being overwhelmed by next week, and 900 more beds are needed. The health minister says those plans are in place to accommodate.
Every hospital in Ontario has been given permission to go ahead and add to their capacity in the way that they see as most appropriate. For some of them, it may mean renting space in hotels or motels. Some of them are using space in retirement homes, and some of them are actually creating field hospitals. So they're ready to go whenever they need to increase their capacity, and that's something that's calibrated on an hour-by-hour basis, and depending on where the outbreaks are happening. In terms of human resources, we have set up a website where people can volunteer to help. We've received over 10,000 applications already from people who are ready to staff these units. These may be nurses who may have retired who want to come back into service, medical students who are going to help us with the contact tracing.
Now, Premier Doug Ford also said he was disappointed in U.S. President Donald Trump, who ordered 3M to stop sending badly needed medical equipment to Canada. And you're probably wondering just how long these restrictions will have to last, especially after hearing the pandemic could continue for up to 2 years. Well, the restrictions won't have to be in place that long. Today, Peter Donnelly, who heads up Public Health Ontario, said we're a ways off from easing restrictions, but that eventually more and more people will get the virus, which will lead to a herd immunity. He added complex modeling will have to be done, and the data will determine when we can start returning to previous lives.